Becky Nelson Fellowship.
Oh,
You have been awarded the Becky Nelson Fellowship.
oh my gosh.
The fellowship program is a really special honor to Becky Nelson. Obviously, a very powerful executive nursing leader, but more importantly, always was very important to her to learn, to give back, to really understand how people do their work.
I've been doing emergency call here as the primary daytime ER clinician for the last few years. Living in a rural setting is like its own little, it's a joy and it has its own challenges. And the people who live and make their life in a rural area, many of them are reliant upon them for agriculture. You know, they grow our food, they grow, the things that feed the world, and that's kind of central to the people that they are. But it also cultivates a tough person, and that person, is going to feed those cows today if they have pneumonia or they don't.
She was in my office a couple months ago saying, Dawn, I want to make a difference. I really want to make a difference in people's lives. I want to improve the care we provide. How do I do that?
Destinie will have an opportunity to be in meetings with executives, meeting other individuals, the nurse executives from the other markets. So to go visit Bemidji and Bismarck and Fargo. So again, as she represents the rural voice for Jackson, Minnesota, or our Sioux Falls market, as she has that experience, as well as being able to attend meetings that most individuals in her clinic and emergency department role here would never have the opportunity. We're able to give her those experiences to meet individuals that can help her with her project.
It's like old problems with new solutions. And I feel like that gives us opportunities to figure out how we could coordinate better.
When you think about what our strategic position statement is about becoming the premier rural healthcare organization in the United States, it's people like Destinie that are the folks that are going to help us make it happen. That it doesn't matter what zip code our people live in, we still want to deliver world-class care.
It's awesome because I truly didn't know if a person from a rural setting that has a day job, working boots on the ground in medicine, was going to be able to have an opportunity to serve in a role that would have been leadership at a higher level besides the facility that you are in now. I feel kind of humbled by it. I hope that I can learn something from this experience and that I can add something that maybe makes a difference in the future. I mean, that's my hope.